Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about another test which we usually do to assess the clotting activity in the body, that is your APTT or Activated Partial Thromboplastin Time. So this APTT is another blood test which measures the time, how much time does your blood take to clot. This usually measures the efficacy of your intrinsic pathway. The prothrombin time which we studied, it measured the efficacy of the extrinsic pathway. Okay, so this test is usually done to see how much time your blood is taking to clot, especially if the patient is on blood thinners like heparin. We want to monitor the blood clotting activity. We use this test, that is your APTT. So now how does this test work? So I've told you that this APTT measures the intrinsic pathway. Okay, so the intrinsic pathway is your 12, 11, 9, 8 and also the common pathway. So all these are the factors which are evaluated by this APTT. Okay, and usually it is ordered with PT for in most of the cases to get a complete picture of your clotting system. So this is your extrinsic pathway and this is your intrinsic pathway. Extrinsic pathway, we have studied the prothrombin time, which your factor 7, okay, which is initiated here by tissue injury, whereas your APTT measures the activity of factors 12, 11, 9, 8 and your common pathway. Okay, and your APTT measures this time. So you know that this intrinsic pathway and extrinsic pathway converge into a common pathway, and the factors help in conversion of prothrombin to thrombin. This thrombin, what is produced? You have to remember it is very important factor. This thrombin, it will activate factor 5. Factor 5 is going to activate factor 10. Thrombin is going to activate factor 8. Factor 8 is going to activate factor 9. Okay, so you will see that because this thrombin activates factor 5, this in turn activates factor 10, it activates factor 8, in turn activates your factor 9. So when we are giving heparin to the patient, heparin, what it does? It blocks thrombin, isn't it? It activates antithrombin 3 and it also inhibits thrombin. So because thrombin is inhibiting these factors also, we use APTT to measure or to monitor the heparin activity. So I hope it is clear why are we using APTT to measure the to monitor the heparin activity, because heparin acts by activating antithrombin 3, it acts by inhibiting thrombin factor 10. This thrombin, it is inhibiting, it will activate factor 8, hence factor 9 is involved. It activates factor 5, hence factor 10 is involved. So because this involves the factors of this intrinsic pathway, we use APTT to monitor the activity of heparin. Okay, so APTT, it measures the time required for your blood sample to clot after a specific reagent is added, and it will assess the clotting factors like factor 12, 11, 9, 8, 10, 5, 2 and fibrinogen, which are the part of your blood clotting process. Now, why will I need a APTT, or when would my doctor tell me to get an APTT done? You have been scheduled for a surgery, or you are having bleeding diathesis, you are having or bruising very easily, you are forming blood clots very easily, you are passing blood in your urine, you're passing blood in your stool, you are having gums that bleed very easily, a very heavy menstrual period in a woman, there are nosebleed, unexplained nosebleeds, there are pain and swelling in your joints. Okay, so to diagnose all these bleeding disorders, unexplained or easy bruising, easily or excessive bruising after an injury, all these will require to assess your clotting activity of the blood, and hence we will require your APTT, PT, etc. I've told you when the patient is put on heparin, to monitor its correct therapeutic range and correct level in the blood, we require APTT. You have been scheduled for a surgery. To know the risk or to know the patient's ability to clot the blood during the procedure, after the procedure, we need this clotting test like APTT. To investigate other conditions, or to monitor other conditions rather, like in the liver disease, when the liver is failing, to see how bad the liver condition is, to assess the conditions of your liver, or in DIC, or in certain autoimmune disorders, we will require your APTT. The normal range of APTT would be around 25 to 30 seconds. This is the most common cited range, and age, gender, and equipment and laboratory, there will be certain variation. What you have to know about APTT is that if you are getting increased APTT more than 35 seconds, that means your blood is taking more time to clot. Okay, and if you are getting a shortened APTT less than 25 seconds, that means your blood is clotting very soon. Okay, so that is the meaning of prolonged APTT and shortened APTT. And if at all your APTT is more than 70 seconds, then it is critical value. Okay, you will have to inform your doctor immediately. So now what are the causes for high APTT? One is, I've told you, the liver. Liver produces most of your clotting factors. So any disease involving the liver, liver cirrhosis, hepatitis, etc., can cause abnormality in these clotting factors, and hence your APTT might be abnormal. Vitamin K deficiency. I've told you that there are factors like 9, 10, which are all dependent upon this vitamin K. So when there is vitamin K deficiency, even your APTT might be prolonged. Hemophilia. Hemophilia A and hemophilia B. Hemophilia A is factor 8 deficiency and hemophilia B is factor 9 deficiency, both which are involved in your intrinsic pathway. So APTT will be increased. Von Willebrand's disease. If you are having deficiency of clotting factor 11, 12, 5, all these can also increase your APTT. Whichever factors which are involved in the intrinsic pathway, if they are not functioning properly, your APTT is bound to be more. You will also get an increased APTT in antiphospholipid syndrome like lupus, anticoagulant, etc., where they will inhibit these clotting factors. Okay, so your APTT will come high. DIC, disseminated intravascular coagulation. What happens here? There is abnormal coagulation, consumptive coagulopathy. Most of the clotting factors are used, so your APTT will be affected. In sepsis, sepsis is again a hypercoagulable state. To limit the spread of infection, the body tries to make more and more clots, so all the clotting factors get involved, so APTT might get prolonged. Malignancy is again a hypercoagulable state and is also a state of chronic inflammation leading to this clot formation. Hence again your clotting factors are involved, and your APTT might be high. And certain medications which we have spoken about, heparin. So the most common anticoagulant which we use to prevent these blood clots, they are going to prolong your clotting time. Okay, certain other medications also like your antihistaminic, your salicylates, chlorpromazine, etc., that can also affect your APTT results, but heparin is the most commonly used anticoagulant which can prolong your APTT. And because of laboratory errors, improper collected samples, sample handling, pre-analytical errors, whatever are there. They have not corrected the sample correctly. The blood to citrate ratio is not maintained. They have drawn a blood from your heparinized line, or they have performed a test on a sample which is already clotted. All these can give abnormal or increased APTT results. So these were few causes of high APTT. Sometimes you would have heard a test called as PTT also. So whether APTT and PTT both are same? No, there is certain difference between APTT and PTT. APTT is Activated Partial Thromboplastin Time. Okay, so this refers to a test of activated blood coagulation which is used to evaluate the clotting factors of the intrinsic pathway. Now PTT, that is partial thromboplastin time, refers to a test which is used to measure the time taken for the blood clotting in order to diagnose your bleeding problems. But in PTT what happens, we are not using any activator. Okay, whereas in activated partial thromboplastin time, we are activating the process. So here we use an activator. That is the only difference. So here in activated, the name itself is activated. So we are using an activator. So here an activator is used. Whereas in PTT, we do not use an activator. Okay. So the reference range of this, because we are using an activator, the reference range would be less. So that would be around 30 to 40 seconds. Whereas we are not using an activator, it would be little higher. You can see about 60 to 70 seconds. Okay. So here it is narrowed because we have used an activator, and here it is a regular time which we are taking for blood clotting. So if at all, if it is more than 70 seconds, then it is critical, and if it is more than 100 seconds of PTT, then it is critical. So that is the difference between APTT, activated partial thromboplastin time, and partial thromboplastin time. So these were few things about APTT test. The most commonly used test along with your PT helps us to get a lot of information of the blood clotting activity, helps us to monitor heparin treatment. Overall, to know the clotting activity, especially the intrinsic pathway, to monitor it, we will use this APTT. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.